One of the most common questions we ask somebody before any heart operation is, do you feel limited in your lifestyle? And people will say yes. They'll say, I used to be able to go hunting. I just can't do it anymore. Or, I'm working in my garden, and last year, it was no problem. But this year, I don't know what's wrong with me. I just can't do it anymore. So people do feel limited. And so in the immediate, we expect that they will feel less limited. So we talk about quality of life improving because you're less limited. Then we talk about, is your life going to be prolonged? So the most common symptom is the shortness of breath when you do something. So we keep it very simple. We have levels. It's level 1, 2, 3, or 4. So level 1 is, I'm short of breath only when I go jogging, and that's pretty much normal. So that's, that's a person who we'd say has no symptoms. Level 2 is somebody who's short of breath climbing one flight of stairs at home, for example. So typically you'll hear patients say, I'm okay, but as long as I stop in the middle. Or they'll say, I have to take a nap every afternoon. So those are some of the symptoms you could have. Level 3 is you're short of breath getting dressed in the morning. And level 4 is you're short of breath trying to speak 2 sentences. So that's the most basic thing. Sometimes the pathway begins with the decision to have the operation. Then once you have that decision, you meet the members of the team. You meet the members of the anesthesia team. You go to the unit where you'll be having your recovery, and you meet the nursing team. You watch a video that helps teach you about what you're going to be experiencing. You can even visit the room that you're going to be in. At one point in all the preoperative visits, we explain exactly how this happens. So there's an hour of anesthesia time, then there's an hour of opening and preparing the heart to get connected to the heart-lung machine. It was 2 hours to work on the heart, and then there's, making sure there's no bleeding and everything looks good. So this helps to alleviate the patient's stress by explaining to them that the actual time we work on the heart is 2 hours, but there's a whole pathway. Same thing. When you finish your heart operation, the first thing is to recover is the first day. That's the most intense day, when you're freeing yourself up from all the supporting machines. Then the first week, you're getting your intense physiotherapy. Then by the end of the first month, you're starting to drive short distances in the car. If you're going back to work, then usually it's a minimum of 2 months. If you have any form of manual labor or Department of Transportation related labor, then it's 3 months minimum before you can go back to work. For people who do athletic activities, we remind them that they haven't been using their muscles the same way for 2 or 3 months. So then that's a gradual return to athletic activities over a 6-month period. Every member of the team is invested in the success of the patient, of the person, not necessarily in the success of just the operation. We stress the success of the person's life. I think When everybody invests into that way of thinking, the patients will get a better experience.